For months, paramedics have been warning us of long wait times and how often a city like Edmonton or Calgary has no ambulance available because of a system under pressure. Now, the government is responding.
That the system has been under strain. There's been a 30% increase in calls since the summertime.
Call volumes at historic highs. Alberta's health minister blaming a combination of things: COVID-19, the opioid crisis, winter weather, and staffing challenges. This past week in Airdrie, fire trucks needing to take 2 patients to hospital because all available EMS were at other calls.
The reality is the delays that day were too long.
Our members have been talking about this since the mid-2000s as an issue here. So it's nice to hear that there's some movement.
The union, representing a large number of paramedics, is glad a new working group will be looking at long-term solutions to address staffing shortages, burnout, and wait times, as well as more immediate action. Like when there's a collision, it used to be ambulances were always sent to check if there's anyone hurt. Now, they'll only go if there's a report of an injury.
So some people may wonder why we waited until just now to move on these ideas.
Alberta's top paramedic says much of this work has been happening for months.
And perhaps not as diligent as we should have been on talking about them.
To immediately start public reporting of red alerts so Albertans can see the reality of what's on the ground.
The opposition NDP sharing numbers of red alerts, showing how they have been rising in Alberta.
This government needs to start telling the public what the system looks like, because now all of a sudden it's a surprise to some people. Well, I didn't know that. Well, it's the reality that's been there for a generation.
Stressing it's a complex problem linked to the entire healthcare system, like how paramedics keep getting tied up in hospital hallways, waiting for patients to be admitted. Sometimes one paramedic taking on multiple patients so others can get back on the road.
Staffing. It's not about furniture in the healthcare system. We've got plenty of beds. It's about the people. And that's what we've got to work on.
In Edmonton, Carly Robinson, City News.